Just waiting for the door here. I have to do it myself. I don't know, hard to get good help nowadays. Kia ora koutou katoa, talofa lava, no mai haere mai ki te manatū hauora. Welcome, nice to have you all here today. As you can see, I've got Brigadier Jim Bliss here with me today, and the purpose of our discussion is to, in particular, talk to the two audit reports on the Grand Millennium and the Grand MIQ, which have been released today. Before I start, though, I would like to apologise. First of all, we haven't got any sign language interpreters, despite our best efforts. We will release a transcript of the stand-up as soon as possible. I can confirm at this point in the day that there are no community cases to report, and the numbers around cases in MIQ and other numbers will be available at 1 o'clock in our statement. Before we move to the reason that we are all here to talk about those two audits, I would like to discuss quickly a couple of other matters that have been reported on this morning. Firstly, there were initial reports of 2 Air New Zealand employees self-isolating after potential exposure to a positive COVID-19 case. Now, the case being referenced to an airline night flight that came into Auckland a couple of days ago. This was a freight flight, and normally the crew would stay airside on the aircraft and would then travel back to their country they've come from. In this case, through the pratique procedure, it was identified that one of the crew members had symptoms. So when they arrived, they were taken to our quarantine facility, tested and found to be positive. Likewise, the other members of that crew were also then transferred to the quarantine facility. As part of the investigation, there were 2 Air New Zealand ground employees who, as a precautionary approach, were initially considered to be possible contacts. However, on further review, they've now been classified as casual contacts. They were wearing full PPE. There was no physical contact. And so at this point, there's no further action required or needed regarding self-isolation or testing. Secondly, and I'm sure you're all aware from the media release this morning, we have done a full data reconciliation on the number of travellers who have arrived from Melbourne between the 20th and 25th of May. This identified an additional 48 people in New Zealand who have been required to isolate and be tested under the Section 70 order. Now, these people arrived as part of a cohort of 177 that have now been added to the around 4,500 travellers earlier identified. Of that 177, 129 have actually returned to Australia. The balance, the 41 have been, 41 of the balance have been called, advised to get a test and isolate, and they're doing so. And we're just following up the remaining 7 people today through our contact tracing. Now, these additional 177 people were identified after a detailed look back to confirm that we had captured all the quarantine-free travel flights that arrived during the period 20 to 25 May. The advice to the ministry from our border colleagues about the status of affected flights is currently done through a manual process, and that has obviously been re-looked at to make sure there's peer review of that, and we're looking to automate that process. What happened here in the identification of those flights is any flight that's coming into New Zealand for the first time on a route is automatically classified as a red zone flight. In this case, they were actually 2 green zone flights. And when we went back and had a look, we captured that additional 177 people who were on those flights. So now going on to the MIQ audits, I would like to start just with a few introductory comments before handing over to Brigadier Bliss. It's very important that, to start with, the New Zealand public is reassured the overall risk of returnees contracting COVID-19 within one of our managed isolation facilities, or indeed the staff working there and taking it into the community, remains extremely low. It's also important to understand, of course, we do not rely on a single layer of protection to prevent any border incursions or spread of COVID-19. We have multiple layers of defence at the border and inside our managed isolation and quarantine facilities, and that work to create barriers and safeguards to protect returnees, border workers and the wider community is ongoing, and that's the purpose of these audits, to look at how we can continue to strengthen it. And this has been a feature, I think, and one of the strategic strengths of New Zealand's response to COVID-19 is our agility and our willingness to continue to learn and adjust our response. So things like the introduction of pre-departure testing, Day 01 testing earlier in the year has helped to reduce the likelihood of COVID-19 entering or indeed moving around the facility. And well over 50% of our infections that arrive through people travelling into New Zealand are now identified through that Day 01 testing. We've also introduced cohorting of arriving flights to reduce the possibility of spread within facilities. We've slowed the arrival of people, obviously, from those high-risk countries that have got very big, significant outbreaks. And likewise, vaccination of staff in those facilities is a major step forward. 100% of MIQ workers have had their first vaccination, and over 95% now have, of course, had their second dose by June 5. Everyone will have had to have had 2 doses of the vaccine, or they simply will not be able to work in the facilities. So from a public health perspective, which is obviously my main lens on these things, these layers of defence are serving us well and have since the pandemic began as well. There are the other infection prevention control measures inside the facilities. They operate within strict IPC guidelines and standard operating procedures, which are constantly reviewed and updated. And of course, there are the audits, which are regular, as well as special audits like these two, and those are acted on and of course publicly released as they are today. So saying all those measures are not a 100% guarantee, there is no such thing, and indeed we have seen that in Australia over the last few weeks since we started quarantine-free travel with them. So when something does happen, we do investigate, we learn from it, and we then make required changes. So I'd like to hand over now to Brigadier Bliss to make some more detailed comments, and that's generated a lot more interest in the room here. Jim.
Apologies.
Have to use your big voice.
Kia ora and lefalabu, everybody. Today, Dr. Bloomfield and I have released the reports into the in-facility transmission of COVID-19 at the Grand Millennium and Grand MIQ managed isolation facilities in Auckland earlier this year. Each of the reports include a number of recommendations for improvement, and we welcome these. All are either complete or they are underway. Over the last 15 months, we've seen major changes in the MIQ system, and we'll continue to see changes as we learn from our experiences, adapt to new discoveries about this virus. The MIQ system is central as part of our elimination strategy to keep COVID-19 out of New Zealand. The system has served us well, bringing home more than 140,000 people whilst protecting the freedoms that we have today. It can always be better though, and I think we are committed to continually improving our system. We acknowledge that what we do know about COVID-19 is very different to what we knew this time last year. MIQ, along with the Ministry of Health, has taken a close look at these two instances, not at least to see if we can strengthen the wider MIQ system. So to the Grand Millennium first, a review was jointly undertaken by the Ministry of Health and MIQ into the incident at the Grand Millennium in which 3 MIQ workers tested positive for COVID-19 in April of this year. And the initial case was linked to a returnee in this facility. The review found that the overall response was strong. The 3 cases were quickly and effectively managed, and there was no subsequent transmission into the community. While it's not possible to conclude with any absolute certainty where and how the transmission occurred, the report found that it was most likely transmission from case A from the index case was by aerosol transmission in a hallway. Transmission between case B and case C was most likely to be found to be direct exposure from two workers on the same shift. In addition to the in-facility transmission, following the revelation that case B had not been tested for a number of months, KPMG were commissioned by MB to establish the facts around this incident, and I'm also releasing that report today. KPMG's analysis of the evidence found that the staff member had provided inaccurate information to their employer and had falsely stated that they had undergone testing for a number of months when they had not. The employer was not aware of the worker's non-compliance with testing until March of this year due to data quality issues. And we consider this to be obviously not good enough, and we've acknowledged that whilst testing is the responsibility of the employee and the employer is responsible for ensuring the staff is tested, we also at MIQ have a role in ensuring this is occurring as it should across the whole MIQ system. And we are now doing this. So I just talk a little bit more about testing. So the management of staff testing compliance continues to improve, and there have been a number of changes. From the 27th of April, it became mandatory for employers to ensure staff testing records are logged with the Border Worker Testing Register, managed by the Ministry of Health. Those testing records are then matched up with rosters and attendance records. And for us to ensure that we get a reliable data for staff, in February, MIQ implemented a system to capture automatically attendance at our facilities. That system is called Who's on Location, and it allows us to confirm who has worked in the facility and then match it with the Ministry of Health's testing register. The Border Working Testing Register and Who's on Location were being rolled out during this incident and that of the Grand MIQ. This meant systems were not in a position to support active management of staff testing compliance. These systems, however, are now working well. Employers are recording staff testing information into the testing register, and we are cross-referencing that. We can use that information to proactively support employers and employees to meet their obligations for surveillance testing. For example, this week, 96% of the staff were found to be compliant or meeting their testing obligation. And that excludes, however, the Hamilton numbers because of the cyber attack to the Waikato DHB. Of the remaining 4%, a significant number have had their tests in the last few days, but because of the lag between the test and the upload in BWTR, that reflects in that 4%. But they are, however, compliant. MIQ has moved from what was a pretty high trust model to a model where employee, employer, and MIQ now share a greater responsibility for ensuring compliance with the testing order. What happened should not have happened, but we are in a much better position to ensure it does not again. To the Grand MIQ. A joint review was also conducted into the March incident at the Grand MIQ facility. And the review found that, again, while aerosol transmission seems unlikely, it is nonetheless the most plausible transmission pathway. The risk presented by ventilation systems, as Dr. Bloomfield said, has always been assessed as very low. And because of the range of infection prevention and control measures in place, the review found that the overall risk to the returnees staying at the Grand MIQ was also low. The review concluded that if necessary procedures were followed for managed isolation walks, then we might have been in a strong position, which we have now taken to implement today. The review found that there was a breach in procedure, resulting in the secondary cases blue band wristband not being removed, and that error allowed them to board a managed isolation walk bus when they should not have, and they subsequently returned a positive test. And just to explain what the blue band is, a blue band or blue wristband is issued to those people who have arrived from a low-risk country and to those people who have had a negative day 0, day 1 test. Bands are then removed if positive test results come through, or if someone reports symptomatic at a health check, which happened in this case, or if they are identified as a close contact. There was also a breach in the bus protocol, which led to 14 returnees being classified as close contacts and having to stay an additional 14 days in managed isolation. This included inappropriate than the 2 metres spacing, and the incorrect and inconsistent use of masks by returnees. A number of improvements of how to manage isolation walks have been recommended, and many are implemented immediately when the situation arose and upon review. Two events, we entered the Grand Millennium and conducted a complete full In closing, what we have learned from this is that we need to consistently adapt to how we operate in MIQ over the coming months and even maybe years. We do pride ourselves on being a learning organisation, and that's learning from overseas experiences as well as our own internal and external reviews. MIQ is a complex operation, and there's always the risk of human error. We cannot predict everything that will occur, but we will always review what has happened and make any necessary changes to ensure that what has happened is less likely to happen in the future. I'd just like to take that opportunity as well to acknowledge the MIQ workers at the front line of our workforce, keeping COVID out of New Zealand, the considerable personal sacrifices that they have made to ensure that our wider community is safe. They do a fantastic job. I personally want to thank each and every one of them. Now I'd like to offer the opportunity for questions for myself.
Can you explain to me why there's less of a high trust model now? If I'm a first security guard employed by a private employer and I go on site and I don't log into a wall, and then I tell my employer that I've been tested, how can that be detected?
So earlier on, the high trust model, I'd say when the BWTR was voluntary, it was a mechanism to assist employers in maintaining their staff records and testing compliance. By making it mandatory and then strengthening the who's on location process.
How is it strengthened?
So what we've done is we've reduced the number of entry points into our facilities for a start.
Is it mandatory to log into WOL?
Yes, it is. Yes. So as you come into it's mandatory. Sorry.
Is it mandatory for border workers to log into WOL?
Yes. Well, it's not legislated, but that's you won't get onto the site unless you've logged into who's on location, which then allows the correlation between who's on location and the border working testing register.
So can you clarify if it is a requirement for MIQ workers to use WOL? Because the KPMG report says that in some places, like a paper model still exists.
So who's on location is in every location that we operate.
Yep.
And everyone must use who's on location to enter one of the facilities.
They have to, they're legally required to?
Well, we've put that process into place to make it a requirement to get on the facility.
Well, you set the expectation.
I've set the expectation.
Are you ensuring that it's being enforced?
Yes, I mean, I can't get onto a location without logging into who's on location.
Right. So if I go on and I do that, but then I just tell my employer that I've been tested.
So if you go onto one of our facilities,
yep,
and you get to the door and you don't log onto who's on location, you won't enter the facility.
Yeah. Okay. So if I go to work and then it comes up that I need to be tested.
Yes.
And then I just tell my employer that I'm tested, even if I'm not.
Yep.
How does that get?
Okay, so we've created a team in MIQ that then takes all of the data out of BWTR each week, and we then go through with the employers and say, by name, these are the people who have not reported as being tested, and we then give them that information so they then chase up their staff to ensure they are being tested. And
what if the staff just tell them that they've been tested?
It's not a high trust model. They have to provide proof to their employer that they have been tested. So that would be, for example, the return of the text message of being tested, or it's recorded in BWTR, the test result. So the employers now have the access as well to BWTR to be able to verify and interrogate that data themselves.
Does that include whether they've just been tested, or does it now say if they've tested positive?
It doesn't include their result, but if they have tested positive, then it kicks into a health response, obviously, through the DHB's Ministry of Health.
At the the time of the KPMG report, there were 60 first security personnel who couldn't match up their NHI numbers. Do you now have eyes across every single border worker matched up the NHI number?
So we continue to work with NHI numbers, remembering that we have a very fluid workforce. So we are always onboarding new staff. So every week there will be a number of staff that have come in, either casual workers or the like, who still have the NHI numbers to be matched. Once they're matched and they sign into who's on location, we then use the NHI number and the who's on location to then ensure that they've had a test.
How do you quantify continue to work with, though?
Sorry.
How do you quantify that? Like, how do you quantify we're continuing to work with? Like, what sort of numbers,
Sure, yeah.
How big is your blind spot?
No, it's not a blind spot. So we have staff, we have a workforce of over 5,000 people could be working on any of our sites, our 32 sites, from over 300 employers. So they're always bringing on new staff as well. So we continue to work with those employers to ensure the data is correct. And it's important that when we put the data into the BWTR, that everything is correct, like the NHI number if they have one, their date of birth, their contact details, and the like, so that we're not creating duplicates. And we've spent a lot of time since February going through and scrubbing data to make sure we are accurate.
But this comes back to, not knowing how many border workers are being tested, not knowing how many border workers there are. This comes back to sort of warrior numbers, what is the denominator here?
So the denominator is on any given day, we have a workforce number that is on site. We know that through who's on location, that they have checked into one of our sites and that they are working on site. That then triggers the requirement for them to be tested within the 14 days or the 7-day testing requirement.
And also, and one of the other issues highlighted in the report was that sort of the on-site testing was lacking. And so are there workers who have to go on their own time to go get tested?
So the DHBs in each of the regions have worked out a testing regime with the workers in each of the facilities. And that includes 24/7 coverage of that. We've found that there has not been any less percentage that can access testing regardless of whatever shift they're on. So that the testing is conducted within the facility. Some employers also provide the opportunity and support their employees by getting them to testing when they're off shift. So if you're on leave or you're on days off or stand down and your testing is required, some of the employers facilitate that either by paying them or by even transporting them to a testing station.
Does that MB team that goes through the BTWA data, our data each week and works with employers to make sure the workers are being tested, does that team also work with private employers outside of MIQ?
Yeah, so that works with all of the public and private employers. It provides that data back to them.
Across the whole board?
Across the whole board.
Whole border. So the border worker testing register, as Jim said, is now compulsory for all organisations who have employees that are required to be tested either every 7 or 14 days. And the MB team works closely with our health team as well. And the process of matching NHI is a really common one that we do, even when anyone turns up to a GP or to hospital. So there's a whole system in place that allows that matching to happen based on a person's, name, date of birth and address.
So no, I was going to ask you what I asked you yesterday. Can you tell us how many border workers who are in both the data matching that's available, who are on site at the border, who haven't been tested?
Yes, we can tell you that. Although I think your question yesterday was about their vaccination status, was it not?
That as well.
That as well, yeah. So we're just working on that. But the process that Jim's described around MIQ workforce happens for other border workforces as well. So there is feedback to employers of people right across the border workforce. And those employers are now able to interrogate the database themselves. They can go in to help them fulfill their responsibilities to check if someone has been tested and indeed if someone has been vaccinated.
How did it take so long for the employer notification to be up and running? The BWTR was live or trialed since November. That employer notification wasn't live till the end of April, well after the case B at Grand Millennium had actually tested positive.
Yeah, so that functionality was being added. In the meantime, employers could ring our team and they would interrogate the database and give them that information.
Why did it take so long for it to go live? It was actually in the user manual that was sent to employers.
Yeah, so it just was a matter of adding the functionality, testing it and making sure it was working properly. And these things can take time. Our teams have shown over the last year and a half that they move with great pace to stand up new systems, and I think they did this as quickly as they could. The fact the border worker testing register is now compulsory, employers can interrogate it, and we've got teams in MB and here in health who are supporting both employees and employers to ensure that people are getting tested as per their requirement, I think has improved things markedly.
To clarify, because I'm not quite clear on this, who inputs information into the border worker testing register? Is that the sort of nurse or what have you who does the swab? No. Yeah.
Yeah. So so employers are required to provide lists of all the people who are employed, and I'll focus just on MIQ because that's what we're talking about today. But as Brigadier Bliss has said, also when people, and they are required to use who's on location, and that might include tradespeople who are just coming in to do a job for an hour or two, they are still required to use that. They may not be subjected to a testing requirement, but some of them may be, depending on how often they're coming in. Once they're in the border worker testing register, because the employer has given their name and they load it up, then the process of linking the fact of a test is a linkage between the laboratory database, so when the test gets registered, and that connects up to the border worker testing register and will indicate whether someone has returned a result, really. But there is sometimes that lag, as Brigadier Bliss talked about, 24 to 48 hours, someone might have been tested on time, but the result may not have been entered, and those people will show up as being overdue. But they do receive messages. The individuals receive reminders about their test coming up and also their test result by text.
So why did the testing register say that case B had been tested when that wasn't true? How did that false information get into the register?
So just to be clear there, the border worker testing register did not show that. However, there was a difference between the employer's records, what was in the border worker testing register at the time, and what the employee's account was. And so that was why we were wanting to make sure that we had got to the bottom of exactly what the truth was. And then as soon as we knew that we had been able to confirm the testing status of that employee, then we made that information.
So the register didn't show non-compliance. It showed non-compliance at the end of April. Or should it show non-compliance earlier?
What it showed
It showed non-compliance in mid-March. I'm getting my months mixed up. It showed non-compliance at the end of March. It also showed non-compliance in the middle of March, but it was only because of attendance data. And then when he said I actually went, then it showed that he was actually compliant when he wasn't.
There are two separate things here. The border worker testing register did not show a recorded test result for some time, but the employer's record, which was separate, showed, based on the information provided by the employee, that the person had been tested. At that point in time, therefore the employer was not coming to our folk on running the border worker testing register saying, can you confirm for me? Because first of all, they weren't required to use the register, and secondly, they were taking on at face value the report from the employee that they were being tested.
But he was in the register, and
Yes.
they had the NHI matched with him since March 10. Shouldn't a red flag have been thrown up on the register at that point?
So at that point, the register was recording, but not signalling to all employers, remembering that the register was not compulsory at that point in time, because employers were required to keep a record, and that's what the employer was doing. They weren't required to use the register. That is now all linked up, so there is a sort of a fail-safe mechanism at 2 or 3 levels.
Since when has that been linked up?
Since it became compulsory at the end of April, yes.
And how long has the MB team been going on its weekly?
On the week checks. So I'm not checking or creating that data. So we started to pull that data in March. We started to pull the first reports, and remembering that we uploaded data into BWTR in late December. We did a mass upload of all the manual data that we had, and we then did a
you just said there was now an MB team looking at the data weekly.
Yes,
asking,
so
since how long has that been going for?
So that's been started only in the last 6 weeks to put that team to specifically interrogate the data. We've had people working with Ministry of Health, but largely that work has been done around the accuracy of data to ensure that we're providing the best data available to the BWTR to assist and ensure the workforce is widely understood.
Do you have an idea of how many people in the register who are not linked to an NHI number?
It would be a small percentage, and it would be people who have just recently been employed. Most people, as they come on, will have an NHI. If we find someone who we can't link to an NHI, there's a process to go through to make sure that all the information is accurate, but they haven't got a pre-existing NHI. Most people do. If they don't, then they're assigned an NHI, and then that can be matched up with laboratory database and other health databases as well.
How has this taken 8 months? Since the public health order came in August, came into effect in September, how's it taken 8 months to get to the point that you're certain on the data?
Well, in the first instance, the border worker testing register was not compulsory, and so some employers used it because they had a requirement on them, a legislative requirement, to keep a record of the testing status of their employees. It is now compulsory, and so there is a full functionality there. All employees and the over 300, in fact it's over 500 because there are a couple of hundred that are considered as one under MB, those working at MIQ. All their employees have to be in the single register. It's able to link to the database, so we can now quite accurately, very accurately, determine if someone's complying with the testing regime.
Yes, the bottom line is-
Should I just say that this is, there is complexity behind it, and so the teams were working as hard and as fast as possible to ensure that the database and the border worker testing register and all the processes around it were able to support the intent of the order.
Then under that public health order, the employer and employee broke that public health order. Will you be seeking consequences or following up with that?
Well, the employer was actually fulfilling their responsibilities, in my understanding, because they were keeping a record as required. They were keeping a record of their employees' testing status.
But
But it was wrong information.
But-
And we don't check the
So,
private employers
think-
at the border.
will you be pursuing consequences against the
So,
employee?
yeah, there is a worksafe investigation that's currently been initiated with that employer at the moment, which is yet to be concluded. So that would be where that recommendation or any consequence come from.
I just want to check before we finish. Are there any other? Is
Yes,
anyone else who would
sorry,
like
I
to ask
have
a
on behalf.
question?
I have some on
Yes.
behalf.
Well, let's go. Let's go.
Just have one more
Thank you.
question.
It's
Please.
the wristband system that
Yes.
determines who can go on the managed isolation walks. Is that still in place and is that working?
Yes, it is. It's, we continue to refine. I think that the important thing is the process around the wristband to make sure that the staff are inducted and trained and understand, the protocols as to why we would remove or replace the wristband. So there's been quite a lot of effort put into induction training, staff training, supervision, and then ensuring they have the tools to be able to manage that system. So yes, it is.
So you're pretty confident that's not going to happen again with the wristband?
I think we've also improved that system to make it stronger, in that we can have a system of allowing people some freedoms whilst they're in MIQ to take exercise or to fresh air, which I think is very important, and it's proving to be a very effective system to do so.
Are you seeing capacity issues in the other MIQ hotels, given that 2 of them are currently still empty? Is that right?
So at the moment, I suppose the benefit for us is with quarantine-free travel and the cessation of the India flights is that we're not high on capacity at the moment. We are holding 500 rooms as a contingency as quarantine-free travel. Obviously, we work through the bugs of that, but we are not short on capacity at the moment. I do acknowledge that later on in the year, as we look to open up to other group arrivals or initiatives, that capacity will become once again more of a concern.
What's the time frame for opening those hotels, having the ventilation all working?
Yeah, so I'd say, I won't say imminent, but mid-June is what we're looking at. The thing is with ventilation reviews or any remediation work, when you pull a panel off, expecting to conduct what is a pretty simple task, sometimes you do find other things that need to be remediated. We'll take that opportunity to do any remediation that we need to.
Dr. Bloomfield, I just have 2 on behalf, if you wouldn't mind. Apart from border workers in Group 1A, are you happy with the current uptake of vaccines among other priority groups?
Yes, and I think what we're seeing is ongoing increased uptake amongst priority groups in Group 2, as well as, of course, the rollout in Group 3, which is now happening across all DHBs.
You keep saying we're on track or ahead of our own targets in terms of vaccines, but data we have shows that looking at specific groups, there's a lot of work to do. Do you think you're being as transparent as you could be with the vaccine uptake?
Yes, we've been very transparent. We're publishing the data every week on breakdown by DHB, also by ethnicity. And one of the things that perhaps to say is remembering that when we first started the program back in February, we anticipated there would be about 12,000 border workers and their whānau who were in that first group. Actually, it transpired that group was near around 25,000, and so obviously it was a bigger group. So that then meant that there was a flow-on effect to the availability of vaccination slots for groups 2 and now into group 3. But overall, yes, we're running at 109% of what our plan was, and we'll continue to be transparent and different about the rates in different groups.
But if you're not measuring who's in which group, how are you, measuring yourself against your own targets?
Well, the key thing we're measuring ourselves against, of course, is our overall coverage for the eligible population group that is 16 and above in New Zealand. And the sequencing framework was designed specifically for that purpose, is to ensure that we sequence starting with those at highest risk. And it's that border worker group, and particularly the MIQ worker group, that is the most important in terms of another layer of protection. After that, of course, we're aiming to vaccinate as many people as possible in the population, and we're making good progress towards that.
Have you got an update on the households of border workers and update on vaccination on that?
I can come back to you on that as to what the numbers are for that. Again, that's one where it's very difficult for us to know the denominator, but we can give an update on it.
It's something that the minister was quite keen to push because that number, the uptake was quite low.
Initially, it was quite low, yes, and we have been doing a lot of work with that group since. Thank you very much. Before we finish, Can I just
ask, the bottom line in this report is, if someone isn't being tested and is maybe lying about it, or the employer, if it's a government employer or a private employer, isn't keeping the records, even though they're legally required to do it, will we know?
Yes,
that is the bottom line.
That is the point now, because everyone working in MIQ now has to be on the border worker testing register. Their presence in a facility is now mandatory. And
I'm not just talking about the MIQ though, I'm talking about across airports and...
Yes, that's right, because we now have the border worker testing register that is compulsory for employers to use it, and there is an active process of following up if people who are required to be tested are not registering a test result in the border worker testing register, and the team at MB and our team at Health works with employers to make sure they are getting that information and that they are, like us, following up the employees.
And sorry, and just to clarify, so the border worker testing register, that encapsulates the nasal swabs as well as the saliva testing?
Yes, that's one of the processes we need to put in place to put into the saliva testing into operation, is to make sure those data are also included in that. Just before we finish, I just want to say this is Professor Brigadier Jim Bliss's final media stand-up. It's a swan song. He's finished coming to the end of his 6-month term in what is probably one of the toughest jobs in the Defence Force. Probably didn't sign up for this, Jim, but thank you very much for the work you've done. It's a tough gig, and I'm sure whatever comes next, even if it's somewhere on the front line somewhere, although I don't think it is, will pale in comparison. But it's been great with you, and thank you very much for your hard work.
You want to stay on?
Put your hand up for another tip, no?